extremely rarely the bleeding can be so heavy that it can cause anemia. Most of the time it is self-limiting. Hello friends, recently I came across a thread on Reddit and it was about pregnant ladies sharing their WTF movements, the movements which took them by surprise. Let's see what their top 11 WTF movements were. Excessive vaginal discharge. So a lady was quite surprised by the amount of vaginal discharge she was producing just after getting pregnant. And it so happens, like when a lady is pregnant, there is surge in the hormones in the body, estrogen and progesterone, and particularly estrogen, which makes producing lots of mucousy discharge from the vagina and the cervix. This has got some role in preventing infections from creeping up in the vagina and the cervix, and thus protecting the baby. And usually this discharge is made up of mucus and dead cells. So the nature of it is transparent, mucoid, non-itchy, non-foul smelling, doesn't have any blood or anything in it. But if in case you notice that there is change in the appearance of the discharge, if there is itching, foul smell, there is greenish or yellowish discharge, if there is blood, that would mean that the discharge is changing its nature, which would mean that one needs to see one's healthcare professional, an obstetrician or a midwife, whosoever you are in touch with, so that they can take care of the condition which has led to change in the vaginal discharge. And this vaginal discharge is what you hear of, that mucus plug. That is what, when somebody is around the time of the labor, a mucoid discharge come out which covers the cervix, and following which we expect that the labor would start. And also when somebody is in around like 40 weeks or so, when one is ready to deliver, one starts noticing pinkish discharge instead of the transparent one. That is called show. That is when it is indicative that the labor might be starting soon. So this is about vaginal discharge. Second one was hemorrhoids. So what are hemorrhoids? Hemorrhoids are also called piles, and they happen commonly in males as well as females both. But pregnant ladies are particularly more prone to hemorrhoids. Like 1 in 4 pregnant lady has a chance of having some degree of hemorrhoids, and that happens, as can be very well explained. There is dilatation of the anal veins, just like there is varicosity of the leg veins. Likewise, there is varicosity of the anal veins, and that is because of the increased pressure of the baby which is coming on the anus, and also because of the constipation that happens in pregnancy because of the hormone progesterone. All this combined together increases the likelihood of a pregnant lady having hemorrhoids. Most of the time, hemorrhoids are asymptomatic. There is swelling there in the anus, but it's not causing any symptoms. But so many times it causes symptoms, like they can get painful, there can be bleeding. So how do we prevent it, and how do we treat it? Complete prevention might not be possible in so many cases, but one can still try by taking a diet which is high in roughage, like green vegetable, fruits, prunes, multigrain diet, taking lots of water which makes the stool soft, taking laxatives if that is needed. It can be also isabgol husk. It can be one of the safer laxative that the doctor writes for the pregnant lady. And if it is painful, in that case one can take paracetamol, because paracetamol is the safest painkiller in pregnancy. Despite that, if it gets symptomatic, then one can use piles or hemorrhoids ointment, which is usually a mixture of local anesthetic gel and steroids. Post pregnancy, majority of the time it will become normal, but in few cases it continues, and in that case one needs to see a general surgeon who can take care of the piles or hemorrhoids and do the treatment as needed. It might be a surgery or it might not be a surgery, depending upon what the severity of the condition is. Now, there were ladies who found that their vision got foggy in pregnancy. So it happens in pregnancy. It is not uncommon to find that suddenly a girl or a lady find that her number of glass has changed, or she cannot see things as clearly as she could to see prior to pregnancy. And this again happens because of the hormones estrogen and progesterone, which causes water retention, and the water retention happens behind the lens as well, which changes the curvature of the lens, and there is change in the thickness of the cornea as well. So these changes again are temporary. One should see ophthalmologist, but at the same time it is advised not to go for things which are like, say for example, LASIK. Don't go for a surgery like that, because that will end up overcorrecting your problem, because anyways it is something which is a temporary problem. If the number of the glass has changed, obviously it can be changed, but then don't go for anything which is very drastic. Remember, it will get corrected once you deliver and the water retention from the body has gone. So many of the ladies, they were like quite shocked with the change in the appearance of their breast, nipple, and darkening of the nipple and the areola. Areola is a structure surrounding the nipple. So yes, it is a fact that in pregnancy, again because of the hormone, there is a lot of pigmentation in the body, not just in the breast but all over the body, including in the pubic area, in the face, everywhere there can be pigmentation. Areola also gets darkened, and these are changes which are there to remain. Like, it will never be in the pre-pregnancy stage. Once the areola or the nipple gets darkened or bigger on the size, it will remain like that. And one has to be mentally prepared for it, that okay, fine, it's a part of pregnancy, and pregnancy is a part of life. Nothing to be, get shocked about it, or nothing to feel bad about it. There are few glands which are called Montgomery tubercles, which are small glands which are adjacent to the nipple in the areola. They also become prominent and more visible in pregnancy. The function of these Montgomery tubercle is to produce oil which keep the nipple and the areola lubricated. Is needed for the good nipple and areola health, so that becomes more prominent during pregnancy, and it stays like that. It can reduce in appearance, but it will be more prominent than what it was before conception. And it is said that babies, when they are born, they cannot see as clearly as one can see later on. So it is nature's way of helping them by darkening the areola and the nipple, so that they can see in which direction they have to face for breastfeeding. So it's one of the theories. So just be happy about the reason why this change takes place in the body. Now, there were so many who found that insomnia or lack of sleep was awful in third trimester. And it's a fact. Even before the baby is born, the mother has sleepless nights, and that is because of the increasing size of the abdomen, of the belly of the lady. It is difficult for her to change side. There is so much of acid reflux, which causes acidity, heartburn. There is babies moving all throughout the night, and one gets disturbed sleep because of that. One feels so much of pressure on the bladder, which makes the lady pee throughout the night, off and on, and obviously all this leads to disturbed sleep. Now, what one can do? Can we do a lot? Actually, we can't do a lot about it. We have to accept it as it is, but few little things which can help is, one can try to use the pregnancy pillows. They can be used in such a way that you try to find the least uncomfortable position. It will be wrong to say most comfortable position, but least uncomfortable position. Also, try to make your room cool. Don't take stimulants like coffee, tea, etc. at least 3 hours prior to your sleep time. Go for a mild walk just prior to your bedtime or after dinner. Take a light meal. Listen to soulful music, and remember that these things are temporary. I mean, obviously, after you have breastfed the baby and the baby is little settled, after that you can again get back your sleep, and everything is happening for a good reason. The D-Day is not long away when you are going to deliver the baby. So just bear with it. I know it's not the most comfortable period. I can relate with my own pregnancy. It was not the most comfortable period, but then it happens. You cannot just not have it in the pregnancy. It is there to be. Food aversions, right? So there can be food perversion, food aversion. And what does that mean and why it happens? It can happen as early in pregnancy as first trimester, and that is because of the increasing pregnancy hormone HCG, human chorionic gonadotropin, which causes perversion, one can start liking things which are of no nutritional value, like which is also called pica, which I have covered in one of my videos, where a lady was eating so much of soda bicarbonate every day, baking soda. So one can take sodium bicarbonate, one can eat chalk, one can eat clay, one can eat paper. So many things happen. Apart from that, one doesn't like the smell of food, one doesn't like to eat, one pukes, one throws, and in fact there are so many ladies who lose weight rather than gain weight in the initial 3 months of their pregnancy. So that is okay. Again, we cannot stop HCG from growing, and nor we want it to stop growing, because that means there is end of the pregnancy. So HCG has to grow, and it will cause all these problems. One can try to realize that, okay, fine, I'm not able to have the healthiest of diet, I'm not able to take protein, I'm not able to have vegetable, I'm not able to have so many things. So in that case, don't feel bad about it. It will eventually get better at some point of time in pregnancy. Eat whatever you can eat, because some nutrition is better than no nutrition. Try to take stuff which you like. Basically, take dry stuff like, say, bread, cookies, which make you feel less nauseous. And if you are having aversion to even these things, then you can eat whatever you like. So just remember, there is a temporary phase, and this too shall pass. Nose bleeding. So there were so many ladies who were horrified by the nose bleeding they faced. And in pregnancy, having nose bleeding is not uncommon, and it can happen from very early in the pregnancy till very late in the pregnancy. Why it happens? Because in the blood supply in pregnancy increases so much in the whole body and to other organs as well, not just to uterus but rest of the organs as well. And so happens in the nasal mucosa. The blood supply is too much, the nasal mucosa is dry and thinned out, and because of that, even slightest amount of blowing the nose or pricking the nose can lead to bleeding, which mostly is small. Sometimes it can be massive. If the bleeding is happening, one can just press it for 10 seconds or so that the nosebleed stops. Sometimes one may need to lay down like this. If in case the bleeding is too heavy, then one needs to put head down like this, because we do not want the blood to go inside our throat. That can be detrimental. Or if the bleeding is too heavy, one needs to see an ENT specialist who might need to do nasal packing so that the bleeding stops. But don't worry, it is not something which is dangerous. Very rarely, very rarely, extremely rarely, the bleeding can be so heavy that it can cause anemia. Most of the time it is self-limiting, and once you deliver, it will get corrected. Keep your room humidified. Do not use too much of heater blower, which you might use in winter, because that makes the nasal mucosa dry. Anything which makes the nasal mucosa dry will have a tendency to make you bleed more. Use something like a Vaseline kind of a thing to keep the nose moisturized. Maintain your hydration and blow very gently if you have to. So this is about the nasal bleed. There were so many of the ladies who were embarrassed by the farting. Yes, in pregnancy you fart a lot, and that happens because of the hormone progesterone, which slows down your digestion. So the food remains in the intestine for longer period of time than it would remain otherwise when a lady is not pregnant. And naturally, if the food is there in the intestine for long period of time, more gas is produced by the bacteria which is present there, and that leads to farting. Can we do anything about it? Not really. You can increase, roughage in your diet, and all that helps reduce this, but it will not be totally corrected, and it is not causing any harm to you. It is not causing any harm to the baby. So just accept it. It's part of life, and others also, they will understand that you are pregnant, and you can't help it. Your body is not the same in pregnancy as it is when you are non-pregnant, and one has to accept it and be just proud of your body. Rolling in bed in third trimester is so difficult. So while I was talking about insomnia of pregnancy, I did talk about this, that it is one of the important reasons that why insomnia of pregnancy happens in third trimester. And because your body is really heavy, and changing side can be a nightmare, and there can be cramp in the lower abdomen, which is also called Braxton Hicks contraction. There can be cramp in the thighs and calves, and all this makes life really miserable. In that case, use pregnancy pillow or the pillows. Sometimes the pregnancy pillow doesn't help. There is no one solution which will fix each and every lady's this problem. You will have to find what works best for you, which position works best for you, and try to go with it. I know it is difficult, but it is not impossible, and you are not very far away. You are in third trimester, you are not very far away from delivering the baby, so just a preparation. What else can I say? Some were frustrated that nausea doesn't end in the second trimester. Of course, yes. The nausea doesn't end in the first trimester. It is a wrong notion that nausea will just vanish away, or you will start feeling absolutely normal from second trimester. You are less miserable in second trimester as compared to first or third trimester. But it won't just go away. Because the HCG level is still there in your body, it is not causing you feel that nauseous as in first trimester. But there will be days when you are feeling good, and there will be days when you are not feeling good. There are days when you will throw up. So in all those situations, you can take anti-vomiting medicine as suggested by your obstetrician, because there are anti-vomiting medicine which are safe in pregnancy. You can take ginger. Ginger is considered to be very good natural anti-vomiting medicine. Take frequent small meals. If you find that acidity is the reason why you are throwing it up, take antacids, and this too shall pass. If you are anemic, you are given iron tablets, and with that can cause constipation. Yes, in pregnancy the need of the iron increases because of two reasons. Because in the mother's body, baby is growing, and obviously the iron requirement is more, just like there is requirement of other minerals. Secondly, there is something called hemodilution of pregnancy. That simply means that the amount of water in the blood, there are two components of blood, red blood cell, which is a solid component, and the plasma. So the plasma increases in volume more in pregnancy as compared to red blood cell. So there is dilution of the blood. The RBC is diluted in the increased amount of plasma, and that spuriously shows that the hemoglobin level has come down. To correct these two things, we do need more iron, which can be in the form of tablets, which can be in the form of dietary supplements like spinach, pomegranate, black gram, jaggery, carrot, beetroot. So there are so many things which you can add in your diet. And despite that, if you find that you are intolerant to oral iron, in that case parenteral iron can be given, which means injectable iron. So IV transfusion can be given, and here we can definitely help you if you're anemic. And why it is important to correct anemia? Because the mother will be symptomatic, she will be breathless, she will feel tired, there is increased risk of having preterm babies, there is increased risk of having growth restricted babies, there is increased risk of having postpartum hemorrhage, there is increased risk of having pregnancy induced hypertension. To prevent all this, it is important that we correct anemia. So yes, if you are intolerant, let your gynecologist know, and she will find a solution for you. Now, last but not the least in this list of problems, a pregnant lady is more prone to teeth problem. Yes, it is a fact that pregnant ladies are more prone to teeth problem, and that is why we find that ladies who never had any cavities or anything, they complain of that in pregnancy. So it's a good idea to see a dentist before you get pregnant. When you are pregnant, your gum can bleed, as your nose can bleed because of the increased vascular supply. That is one. Because of estrogen, progesterone, your teeth can get loose from your gum. No, it won't fall off, but it can get loose temporarily during the course of your pregnancy. And also, one can find that more cavities are detected during pregnancy. That is because the body needs calcium, and it starts deriving its calcium if there is a calcium deficiency from anywhere it can, and tooth is a good source of calcium. So yes, if in case you have a dental problem during the pregnancy, it has to be addressed. You need to see a dentist, but it would be a good idea to see the dentist before you start the pregnancy. So this is just 11 of those long list of WTF movement of the pregnant ladies of Reddit. Do share what were your WTF movements, and do let me know if you want me to do more such videos, or you have any questions, you want to know anything about pregnancy symptoms which you don't know the answer of, that why it is happening. I will be more than happy to answer that. Till we meet next time, have a great week ahead. Bye bye from Kaushiki.